I'm Katie Dusenberry. I'm a radiation oncologist at the University of Minnesota, and I recall very clearly the day Karen came into my clinic. And Karen and I just connected. She was just this a young woman, wise beyond her years, and you know, they were all scared to death. You know, she had this tumor that had been misdiagnosed, as they almost always are, and they were looking for answers about what the best treatment for her would be, and she was great. Just fun to talk to her each week as she was getting treatment. But she was such a kind spirit, and I remember her quite well. I hope my daughter is as wonderful as Karen was. I think she is, but don't tell her I said that. Sarcoma, what, about 13,000 cases in the United States? And yet, here's this small organization that is really, really doing good work, not here just in Minnesota, but they're all over the country. So it's different. It's a different organization.
My name is Jan Maudlin. This is my husband, Tim. And we learned about REIN in Sarcoma shortly after Karen Wyckoff founded it in 2001. I had been diagnosed that summer in June with a myxoid liposarcoma, and we found out about REIN in Sarcoma through Dr. Dusenberry, who is my radiation oncologist. I think for us now, we are just so pleased that it has grown in 24 years the way that it has. Because when I was diagnosed, it was just the very beginnings of that sarcoma community. And so to watch how it's expanded, and the assistance and just the support, and people coming together with each other and talking about their experiences and learning from each other, knowing that you're not alone.
Even today, there are patients coming in who have been misdiagnosed. You know, as recently as a couple months ago, I saw somebody who had a lump. It got ignored. They thought it was a sports injury. Took forever for it to get biopsied, and by then it was a young man with metastatic cancer. So it still happens, and we're working on it. But a lot of doctors, just sarcoma doesn't come to the top of their head, unfortunately.
I'm Sue Wyckoff, and I was Karen Wyckoff's mother.
And I was Karen Wyckoff's father, and was misdiagnosed as a benign lipoma in her armpit. And based on that, wanting to be independent. This is several years later.
Yeah.
Right.
So she said, let's start an organization. I've decided to call it REIN in Sarcoma. And I said, okay, what do we need to do? She says, well, obviously we need to have a fundraiser, and I've decided we're going to have it at the Carousel. That's why it's REIN in Sarcoma. You got to make the best of what you're going through, and if we start an organization, we can help all these people that I've met casually get together socially and get the social benefit of knowing other people with sarcoma. But we can also get the doctors involved and get more research. And she said the patients need groups where they have patient support. So those were her three aims, was research, patient support, and education. She made it quite clear that we were to keep this up. Well, the hopes she expressed to me were that we'd raise money for research because it was an under-researched disease. That we would get people together because it's lonely to have a disease that you've never met anybody else that had. And there were other people, there just were no organizations to get them together. And third, that we would spread awareness so that people could get diagnosed maybe earlier.
What we saw with people at the Carousel, we found people who, for all walks of our lives,
that had driven from across Wisconsin.
There were Karen's friends, our seminary classmates were all there, people from the Senior Federation, which I was working for at the time.
300 people showed up. We thought it might be just us riding the carousel, but 300 people showed up, and they all said, well, this has to happen again. We set up a program called Sarcoma Scholars, And the sarcoma scholars were great. Some of them really put in a lot of time and effort to educate people in REIN and sarcoma, and some just became good sarcoma doctors.
The idea of the scholar program came from the fact that I was misdiagnosed for 7 months before I actually got the correct diagnosis. And we just felt more education and more chance for especially medical students that were coming up to learn and have a deeper understanding of what the symptoms are, how to diagnose them, so that we could help other patients that maybe had the same situation that I did.
Well, I think Karen would be delighted. She didn't ever think much about herself, so it didn't have to be her story, but she's delighted that more physicians are trained in what sarcoma is, that there are more sarcoma places people can go, and that there's more support for sarcoma patients.
We are just so grateful for the REIN in Sarcoma sharing of compassion and encouragement for people at a time that they could be very lonely, very uncertain about their future, and it is the blessing that REIN in Sarcoma brings that we just hope will continue to grow in wonderful ways.
Well, we're just, as Tim said, we're just so thankful for, as the years have gone by, and the fact that 24 years later I'm still here.